we measure physical activity in people with stroke, and what are the appropriate levels of physical activity after stroke? We measure physical activity in a range of ways after stroke. For people in hospital, we typically use behavioural mapping or observation throughout the day to measure activity, but we can also use devices such as accelerometers. Certainly when people go home, accelerometers are a great way of measuring physical activity. At the moment we tend to use them for research purposes, but in the future I think we'll be using them to try and help patients track how much activity they're doing and to try and improve their physical activity outcomes. We really don't know how much physical activity people should be doing for their health. We do know that in general the population is less active than it needs to be. The current guidelines for exercise for people with stroke is that they should be exercising at least 1 to 3 times a week at moderate intensity for about an hour each time. The current recommendations for activity are that people should be engaged in exercise 2 to 3 times a week for an hour a day of moderate to high intensity exercise. For patients with stroke, that can be challenging, and we have a lot of work to do to determine how we can help patients be more physically active and engage in exercise.